Alors, bonsoir à toutes et à tous.
So hello everyone and welcome to this press conference from the Premier of Quebec, Mr. François Legault, who is together with the Minister for Health and Social Services, Mr. Christian Dubé, as well as the National Director of Public Health, Dr. Horatio Arruda. The Premier will be answering questions afterwards in both French and English. Mr. Premier.
Donc, bonjour ou bonsoir.
So hello, good evening everyone. Listen, the situation for a few weeks now has been improving in Quebec, which is very encouraging. We can see almost on a daily basis a decrease in the number of cases as well as in the number of hospitalizations. That is a result of the efforts that have been deployed by Quebecers. So I want to start by thanking all Quebecers who have made efforts in the past few weeks. These efforts are leading to these results. I also understand that many Quebecers are tired of the situation and are looking forward to being able to see their friends, to be able to come back to a more normal life. However, unfortunately, the battle is not yet over. It's not over, and I'd like to explain to you a little bit what our concerns are, what our worries are. It's about the hospital situation. As you know, for a certain number of months now, we have been postponing treatments and surgeries. Right now, we are at 34% of postponements. What does that mean? That means that still today, there are 34% of surgeries and treatments that should have been made that have been postponed. So not only are we not working at being able to catch up because we have had to postpone a lot in the past few months, but on top of that, we are increasing the waiting lists because there's still postponing going on. So we, of course, hope that with the lowering of the number of hospitalizations, we will be able to stop postponing entirely and will be able to start catching up. And I want to send a very clear message. We don't want to put pressure on the nursing staff and other healthcare staff. Of course, in every hospital, we're trying to see, there's these many beds that have freed up. Is it possible with those beds to start what we did before? But it has to also be understood that we are in a situation which is really hard for the staff. So it's been 11 months that nurses and healthcare staff have been at the front day after day, week after week. So it's not easy to say, well, now, we have to catch up. So we have to do more than we usually do. So we have to stop postponing and we have to, catch up. So I just want Quebecers to be able to keep that in mind. And I think that it also explains essentially why today we are arriving at the conclusion that, yes, we can do a small or remove or slighten, lessen the lockdown, but we have to do gradually. We have to do it very slowly to be able to give ourselves the opportunity and give, the chance in hospitals to be able to keep doing the work. So I'm announcing to you that as of the 8th of February, which is Monday next, everywhere in Quebec, we are going to open up businesses, hairdressing salons, and museums. We're also gradually, depending on the situation, in each CEGEP and university, we are going to allow for students to go back to CEGEPs and universities. We are also going to increase slightly external activities that can be done in small groups. So that's where it ends. For all of Quebec, that's where it ends. So we're keeping the curfew. We are keeping the ban on visits to people's homes. We are keeping mandatory working from home, and we are keeping closes, theaters, movie theaters closed, except for 6 regions. There are 6 regions in Quebec where the situation is going better, particularly in hospitals. So there's the Gaspésie and les Îles de la Madeleine, the Lower St. Lawrence, Saguenay-Lac-Saint-Jean, Abitibi-Témiscamingue, Côte-Nord, and the northern area of Quebec. So in those 6 areas, those are 6 orange zones. That means that the other 11 zones are going to remain in the red. So what's going to be allowed, what extra measure is going to be allowed in those 6 zones is that restaurants, gyms, and inside sports activities are going to be able to start again as of Monday, next, the 8th of February, with some guidelines that are going to be pretty strict. We're also, in those 6 regions, going to have the curfew pushed back to 9:30 p.m. rather than 8 p.m. So 9:30 p.m. as opposed to 8. As far as theaters and movie theaters are concerned, we know, and people who are responsible for theaters and cinemas are telling us that they need at least 3 or 4 weeks' time to be able to reprogram things and having movies and all that. So we are going to open in those 6 regions. We're going to be opening movie theaters and show venues as of the 8th of February, technically. So it means that they will be able to continue having financial help of the government until the 26th of February, which is the time where technically they believe that they can start again. But that will only be in those 6 regions as of the 26th of February. So those are the only changes that we are bringing. Those are the only changes that we are able to bring because, amongst other things, of the situation in hospitals. I would have loved to have arrived here tonight with more lightening of measures, more loosening, but I think that it would not be a responsible or prudent thing to do. It would in fact be a lack of respect towards all the healthcare staff in our hospitals. You can also see that we are functioning by region here. And for having spoken to certain mayors and even certain of our members of parliament, some people are saying, yeah, but in my sub-region, it's not going all that badly. And it's true that there are sub-regions where things are not going so badly, but we have to look at all the hospitals of the entire region because it is, amongst others, the greater hospitals of the greater regions. That is where the patients go to get surgeries and in order to get certain more complex interventions. And that is also where COVID patients are treated. So we have to look at not only the situation in each sub-region, we also have to look at the situation of hospitals in every region as a whole. That also means that people who are wondering when my region that's red, for example, is going to go to orange, well, follow the situation in hospitals. The Ministry of Health has started giving numbers on the percentage of postponing for medical treatment. So we have to be able to decrease that in a significant way in order to be able to start doing catching up. So that is one of the criteria that is going to be very important in the upcoming weeks. So to conclude with, what we've tried to do in our choice of where the measures were going to be loosened. First is to give a little bit of oxygen to our business owners. I can understand how certain owners of stores, I can understand how they felt for a few months. It's not easy. Although we helped them financially, I understand that they are ready and they've done it well. They did it well during the period where they were allowed to reopen. That is to say, that they respected the 2-meter distance, the capacity, and making sure that all clients and employees had masks. So I think that we can go with a certain level of certainty into stores. We're also going to be asking that in shopping malls there be surveillance to make sure that people don't gather in shopping malls. Of course, there's also the students in all this. We've had a lot of discussions with Daniel McCann and with public health. I understand quite well, and I think that we all have friends affected and friends who have young children or who are young themselves who have not gone to CEGEP or university in 11 months, and it's hard for mental health. And at some point, young people have to be able to see their friends. They have to be able to see their teachers and professors. They have to be able to have a certain level of social activity. So what the objective is with this, and of course it's going to depend on the situation in each of the CEGEPs and universities, but our objective is that students be able to go at least once per week. So, of course, if it's a class CEGEPs and universities that have amphitheaters where they can have a certain distance between the students that is respected, it'll be easier. CEGEPs and universities that don't have an amphitheater, it's going to be more difficult. This will all need to be adjusted. Maybe the groups will have to be separated. But I just want to tell you that we've often heard in the past few weeks that students at CEGEP and universities say we're talking a lot about, people talk a lot about children in primary school and students in high school, and we talk about people 65 and over, but it's like they've forgotten about us, the students at CEGEP's university. But I want to tell you, we haven't forgotten you. It's a priority that's been discussed many times with public health in order for them to be able to gradually start going back to school. The other thing as well, where we've had a lot of comments, people who go and have a walk on the Mont Royal. I have in mind a few people who spoke to me about that and who say, well, we'd like to be able to go have a walk. You know, a few people who don't necessarily live together. Same thing for those who go cross-country skiing or snowshoeing. So in red zones, it will now be allowed to do external outside activities for people from 4 different residences. In orange zones, it will be 8 people. So that will allow to start having a bit more activity. There's fewer risks outside. It's important to continue keeping the 2-meter distance, but there will be that permission of starting having outside activities. I also have a thought, and I thought about it all weekend. Restaurants, theaters, movie theaters, concert halls, all those who will only be able to open in 6 regions. I understand that it's hard. And the financial programs are going to be prolonged until they can open again. And I understand that it's hard for them. Another point, we're going to get back to you over the next few days and weeks. So the spring break. So the Minister of Education today said, yes, there will be a spring break. That means that schools will be closed during that break. So the students will not be at school. However, what is important is that we plan that by spring break, the situation is going to remain difficult. That's what we predict. Things are going to remain fragile. So I want to send out a message to parents. Now is not the time to go and reserve cottages, many families in the same cottage, that you can't do that. We have to continue. We continue not recommending interregional travel. And secondly, we can't mix family bubbles together. So already, I'm very happy with the decision of the federal government of banning flights towards sun destinations. However, there are still things that have to be respected as far as vacations are concerned within Quebec. So I know that it's not fun, you know. I've had children, so it's not easy to find activities during the spring break, but we're going to have to show imagination because we cannot bring different family bubbles together. Another point on which I want to come back to, and I'm going to come back to it again and again, are people 65 years of age and over. We have nothing against people 65 years and over. You know, I'm 63, so I'm pretty close to that. We love them, but we do not want them to be marginalized either. However, it remains that the facts are there. 80% of hospitalizations are people who are 65 and over. 95% of people who die are people 65 years of age and over. So I know that we would love to be able to go visit our parents and grandparents. It is not a good idea. Unless you're a caregiver, it is not a good idea. We have to be prudent. The virus is transmitted very easily. So please, we are going to catch up, you know, that's what we have to tell ourselves. All the moments where we're not able to go see our parents, our mother, well, we'll be able to do that after the pandemic. So I'd like to end by saying the battle is not yet over. We're going in the right direction, but we still have a lot of efforts to make, amongst others, to come and help our nursing staff and healthcare staff. They have been at the front for 11 months. There's still postponing of treatment of surgeries going on, and once there isn't any more, there's going to be a lot of catching up to do in surgeries and others. So it will still be months that will be very difficult for the healthcare staff. So let's think of them, and let's try to avoid as much as possible to catch COVID, end up at the hospital, and occupy a bed that could be used for surgery. So I count on you, and once again, I thank you, all Quebecers.
Good afternoon, everyone. The situation has improved in recent weeks. The number of cases and hospitalizations has decreased. I want to thank you all for that, but we have to remain very careful. We can only lift certain measures very gradually. I'm announcing that from February 8th, everywhere in Quebec, stores, hairdressers, and museums will reopen throughout Quebec and will gradually reopen CEGEP and universities. That will be the only changes on the measures for now, except for 6 regions: Gaspésie, Île-de-la-Madeleine, Bas-Saint-Laurent, Saguenay-Lac-Saint-Jean, Abitibi-Témiscamingue, Côte-Nord, and Nord du Québec. In these 6 orange regions will reopen restaurants, gyms, and indoor sports activities, but with restrictions. And the curfew will now be at 9:30 p.m. For theaters and cinema, they will be able to open only in these regions by February 26. So the battle against the virus is not over. We must continue all our efforts for the health workers. I'm counting on you all. Thank you.
Merci, Monsieur le Premier ministre. Première question, Claudie Côté, TVN.
Thank you. We'll now go to the question period. Hello. My first question for Mr. Legault. We are now in a situation where there's 2 Quebecs, those who are in orange zone and those who are in red zone. You have very clearly said that you do not recommend Quebecers to go from one region to another, but you're not banning it. What are you telling to Quebecers that would be tempted to rent a cottage in another region or a hotel room, and what are they exposing themselves to if they do it? Well, listen, there's not going to be any tickets given. There will not be any roadblocks either. Of course, do remember that there's going to be a curfew, so that means that you have to remain. You have to have gone back inside at 8 p.m. But I'm asking all Quebecers to avoid traveling from one region to another, and to avoid, most especially, to rent cottages, many families, different families. I know that many people have their own cottages and that they go there on the weekend. We ask them to bring their food if they want to go to the cottage, but for the time being, there are no tickets that are planned for. My second question has to do with going from one color to another. You said that certain red zones want to know when they might switch to orange. So what are the criteria that will determine a tightening of measures in the zones where they have now switched to orange? Are there any particular concerns for those regions? Well, first, I wish to thank Quebecers for having respected the guidelines, because the number that we've had over the past few days is associated to the effort that everybody has been making. So it shows that public health measures work when they are applied. So thank you to everyone who has done so and who continue doing so. The decisions of changing colors are made by the directors of public health with the national director, and they made recommendation to the government afterward. We also have to see that independently of what was done in the springtime, we are in a very different context right now, very much other than that in the spring. First, we've been postponing for a long time. Some people should have been operated who have not been, and that is a different element. So the hospital capacity becomes an excessively important element. There's also the number of cases, of course, and the number of outbreaks. There's also the number of new declared active cases, the hospital capacities, and as well the situation in the surrounding zones to avoid people moving from one zone to another. There's also a threat that could emerge even from within Quebec, and those are variants. The new variants, we are actively surveilling them. We have 8 potential cases of the Great Britain strain, and that new variant we are keeping an eye on very intensively. That could change things. And I would say that we're going to meet very often with the Director of Public Health, and depending on the analyses that will be made over the next few weeks, we will see what the red zones are that may go back to orange.
Oui, bonjour à vous trois. Je voudrais savoir, la dernière fois que vous avez parlé...
I would like to know the last time that you spoke of the delay between the first and second dose of the vaccine. At that time, there were variables that were not as present as they perhaps are today. You know, today with the variants that are multiplying, there's another one that was discovered in Ontario, another one in Saskatchewan, and here we're discovering more and more as well. So when you had announced it, there wasn't the same slowdown in terms of the vaccine doses. So do you believe that with those variables that have evolved, are you going to review your decision of giving the second dose in waiting such a long time? The decision of giving the second dose is going to go a lot on the efficacy of the vaccine that we'll have observed in the first people vaccinated in Quebec and those who also were in England and Great Britain and those who were vaccinated in Israel. Right now, we are validating the vaccination efficacy. The first data seems to show that for protection in the elderly, longer than the 14 days is required. So the more we delay the second dose a little bit, that could have an effect, but that really is what it is. The question of the new strains, that is a factor that can be associated to the vaccine, but it's particularly the fact that there's an intense transmission, because every time that transmission takes place between people, there can be mutations in the virus. And there are new strains that appeared even before the vaccines were given in a significant way. So it's hypothetical, you know, the fact of waiting for the second dose, but it's not so much the fact of waiting the second dose than the fact that there's intensive transmission. That is what increases the probability that there is a mutation that will be done. My second question has to do with your choice of colors for regions. The 6 regions that you've mentioned have almost no new cases, and the active cases are also decreasing in many cases. So why not have put them in yellow? And there are other regions like the National Capital region, the Eastern Townships, where cases are decreasing quite a bit. Why not have put those zones in orange to allow more loosening of the measures? Well, when we had discussions together with public health, remember the first presentation that we had from Dr. Rood, I mean, it's been quite a few months, you know, he had told us that one of the criteria that was required, apart from hospitalizations and active cases and all that, was the stability and the trend. In order, and that is what is encouraging right now, the discussion that we had with public health is that in regions such as, for example, the Gaspésie or the Bas-Saint-Laurent, we can really see the stability of the cases, and that's been around for a while now. We can also see an improvement in the Quebec City region. However, we don't yet have stability. The trend is there, but we have not yet reached the stability that allows us to change. So that is why I'd like to remind you that I know that it's been a long time that we talked about it, but that is what guided us to say, yes, there are regions, and I think that the Quebec City region is a good example of that, where there has been a very positive trend in the past few months, but we have not yet reached stability in all of the indicators that we keep an eye on. And that is what guided the recommendations that we received from public health. And perhaps you know, I haven't looked at today's numbers, but I looked at them very closely over the weekend. Over the last weekend, there was no region that had 0 50% postponing of treatment and surgeries. That means that there's still some left, at least there was over the weekend, in all 17 regions. I would like to have clarification on restaurants in orange zones. What will be the modalities in order to be able to go to a restaurant? Is it going to be family bubble? Well, it's going to be by reservation because we have to maintain a registry of people if ever there was an outbreak. And what will be allowed is 2 adults together. So that means that it could be 2 people from the same bubble or not, with children, because if they are children below 18 years of age, they can be present. So the number is not limited in relation to the number of children, but it is limited in terms of the adults. So it's 2 adults. It allows, for example, a family, a father, mother with the children to go eat in a restaurant. If it's 2 adults that could come for different address, what we don't want is multiple family cells. So reservations, registry, and the verification would be easy then. We can see, if it's adults or children. I just want to make sure that I understand. So there could be, for example, a family, 2 adults with their children, but 2 adults from a different address cannot come with other people's children, can they? Well, they have to come with their own children, not other people's children. So if I have my 2 children, and I don't know, my friends have 2 children as well, well, as long as it's 2 adults, you can be with your children. Yes, thank you. And what's important as well, 2 adults and their children per table, okay? 2 meters between tables. Reservations, mandatory. That also reassures us that there are people from the region going to those restaurants. Another question, in the orange zones, will it be allowed for people to visit, for example, families? For example, I don't know, to go visit my grandmother, my aunt, I don't know, in Gaspésie. Nodding no. No gatherings in residences. Yeah, we're maintaining the same rules. No gatherings in people's homes, except for the somebody who's alone who comes and helps somebody out or does groceries or anything like that. But there's no gathering, since we have shown that that is often that context in which there's an important transmission. And that is one of the positive effects of the curfew, because it decreases the probability that people end up in other people's homes in the evening. So you've opened the door for students from CEGEPs and universities to go back partially to school benches, and you wish that it be about 1 day per week, but CEGEPs and universities are autonomous establishments, so is that a request that you're making? Are you authorizing them to do that, or are you ordering them to allow students to go back to school once a week? Well, for the time being, it's a request. Of course, CEGEPs and universities do have a certain level of autonomy, as well as the professors. It's not, all that simple, but we wish to do things gradually. So at the beginning, it will be on a voluntary basis, but I am having discussions with Danielle McCann. We want to make sure that students have the possibility as quickly as possible to go back at least once a week to their CEGEP or university. So we're going to follow what is done in every CEGEP and university. And Mr. Premier, if you'll allow me, there will be guidelines. You can't just open any which way. There's going to be distancing. People are going to have to wear procedural masks. So it's not a pre-COVID-19 CEGEP. It's CEGEP with the measures that are set up. And usually we have excellent collaboration from university and CEGEP, and some more specific announcements will be made shortly. Yes, Danielle McCann is going to have a press conference probably on Thursday to explain all of this. As far as the malls are concerned, we understand that malls are going to be able to open as well. What about hanging out, for example, teenagers? How is that going to be avoided? What will be the measures? Well, I would like to check, but I think that there can be tickets handed out for people gathering in malls. That will not be tolerated. We've had lengthy discussions because there are certain places in Quebec where the only stores that exist are in malls. So if we don't open the malls, the citizens of those areas, as well as the store owners, can't give services to the citizens. However, we're going to be very strict. And we're going to set up procedures, and we have constant discussions as well. You know, there are large mall owners with whom we're talking to make sure that the measures are very well respected. There's no question of starting to have gatherings in shopping malls. So there's going to be people managing access to the malls, to the common areas. There will be, yes, people doing surveillance. Two elements. First, the residences for the elderly. Is there anything that's going to change as on that front? Well, there will also be another press conference from Marguerite Blais over the next few days to explain the new measures. There's no great change, but there will be new measures that will be adjusted. So Marguerite Blais will talk about it, what we'll be doing with dining rooms, activities, depending, depending on a specific RPA or CHSLD. So Marguerite Blais will come and talk to you about that over the next few days, about the procedures that are going to be set up, small changes, tweaks that will be brought. Just so I understand correctly, those tweaks, it's like for CEGEPs and universities, basically. It's there's going to be some loosening, and it's going to be announced later on this week. Is that correct? Well, CEGEPs and universities, we are saying that it's on a voluntary basis. So we're giving the objective that students go back to CEGEP or university once a week. In CHSLDs and RPAs, it's more rules. They will be very detailed, and we'll be explaining it to you over the next few days. Now, about the curfew, am I to understand that the curfew is maintained until a specific date? How is it determined now? We are going to give ourselves probably a 2-week period to come and see you with adjustments. So that means that the rules that we are announcing to you today are until the 22nd of February. Before the 22nd of February, we'll come back and see you and say, well, these are the new rules, and it could happen that we'll change the curfew. But for the time being, we are not planning on removing the curfew. We find it to be a measure that is very efficient to avoid gatherings in homes, particularly with people 65 years and over. I'm trying to understand this, what you're talking about with the activities and culture. My question is for you, Dr. Ruda. Has there been a clear recommendation from public health to distinguish, the filming from other cultural activities? Because they've been allowed to continue, unlike the other activities in the cultural sector. And for the measures that are announced today, are you judging, for example, that, I don't know, a shopping mall is less dangerous than a library or a concert hall? Have you really differentiated the places in your recommendation? We have differentiated them because each sector has particular guides. So filming elements in Quebec have been very rigorous, and on the filming, there's been no outbreaks. So that showed its efficacy. As far as a mall is concerned, as compared to a concert hall, I think that has to be understood is the risk. In malls, the risk is people gathering and hanging out. Whereas usually in a concert hall, you go and you sit in fixed areas, people wear procedural masks and they don't interact. So the risks are associated to that. So we did it in a perspective with very specific protocols. And we know, for example, that in museums, very often people go in small groups as a family or a group of two. They are in rooms, there's surveillance, there's a way of controlling how many people are there. And that is why, as the Premier was saying, the mall zone cannot become a hanging out zone. It's not a place where you stop. It's a zone where people circulate inside to go into a store and come back out. So we're really going to concentrate on that, and in order to not penalize places where there's not necessarily, big spaces, but to avoid to avoid stores that don't have a door that leads to the outside from not being able to open. So every mall is going to have to identify how many people they can allow and intervene if they see any gatherings, young people hanging out or things of the nature. And just to complete, first, it was important for us to quickly allow for filming to take place because we think that it is important for Quebecers that the filming take place. So there'd be series on TV, etc. So we did that quickly. The libraries we had done quickly as well to allow for people to go and borrow books and even to sit down in a library to be able to use the internet, for example. So you can go, yes, you have to go to the counter to ask for a book. You can't walk around. But as far as museums are concerned, we're doing that everywhere in Quebec. We're opening museums everywhere in Quebec. As far as theaters are concerned, for me, it's the same category as restaurants. So the risk is comparable for me. However, theaters and movie theaters have asked us to have a delay until the 26th of February so that they can get themselves organized, as well as to allow for the financial measures to be able to continue until the 26th of February. So in your answer, Mr. Premier, you're saying that for you it's important that filming still take place. So was that decision made by your office, or was it really public health who distinguished the different activities? Always with public health. So was that recommendation specific to filming? It's been a while that filming has been going on. There are very strict protocols for the workers. And so it's been a while that we have let filming go on. At the beginning, we had agreed on the protocols. There were all sorts of different protocols that were proposed, and it was a success. And I wish to say, in Quebec, even certain other in other places where filming kept going, there were outbreaks, But we have series right now where you have the impression that people are much closer than they are 2 meters away, but they are 2 meters away. It's a question of how they do things, but it's very rigorous.
Bonjour. Pardon. Vous avez parlé des
You spoke of inside activities in orange zones. So we're talking here, I suppose, of arenas, inside sports. First, is that what it is? And secondly, are we talking, you were comparing it earlier on to cinemas, theaters, restaurants. So is it going to be the same kind of thing, family bubble registration and all that? What has to be understood is that it's allowed inside in orange zones, but it's limited to individual activities or that two people practice or in a family living at the same address. So dyad. A dyad is two people. So you can play tennis inside. I've had a lot of calls on that. It will be allowed in orange zones. But we're not yet, we're not yet allowing hockey to be played inside, in an arena. So you can practice your sport inside if you're alone or if you're with one other person as such, or a family from the same address. You want to go play badminton with your children, you live in at the same address, you can do it. But as far as outside activities, it's going to be limited to 8 people in orange zones, and in red zones, 4 people. For businesses, and I just want to add something. If there's 6 of you in your family and you live in the same address, it can be 6, of course. The 4 is to limit the number of families that could get together. Businesses, am I to understand that it's still limited in spaces the way it was before Christmas? Yes, in the sense that businesses can reopen even in shopping malls, but we We have to have fewer people because the 2-meter distance has to be kept, etc., to avoid that people end up less than 2 meters away in the store.
Bonjour à vous trois. Concernant donc les
So as far as gatherings are concerned, about the spring break, can we also expect loosening of measures like at Christmas? Can a person who's alone, could they go spend spring break a few days in another family bubble? Right now, that's not what we're planning on for the spring break. It's the last week of February, if I recall well, or the first one in March. We still have time to see what the epidemiological situation is, so I prefer not to answer that right now. Because right now, it's not what we're planning on. We do know that what is planning on is that the spring break is necessary for both the students and professors, and as the Premier was saying, it's not a week like over the holidays where we're going to be allowing gatherings. I wish to remind you that gathering between different families is forbidden. If you're in your family, that's one thing. But theoretically, you're not supposed to behave differently from your color zone. So if you're in a red zone, you can't go to restaurants in an orange zone because you come from a red zone. So people who have a cottage, have to bring their own food. And during the spring break, it's going to have to, some museums are going to be open, the biodome is going to be open, the botanical gardens are going to be open. So those kinds of activities people will be able to do. So we encourage you to do those activities in your territory. It's not time for 4 families to rent a cottage and go to another region. This is really not the objective. Mr. Premier, you said earlier on that filming was important for Quebecers and the Canadians, the Habs is important as well. Better than the referendum, huh? Oh, you want us to come back to that, do you? And museums are important, you said so. However, you're saying that hairdressers are going to start their activities, but what are you telling to people who think that gyms are important for them, for example, and that yoga in gyms is less dangerous than ending up than going to hairdressers, for example? What makes it that a gym is not as essential as getting your hair cut? Well, for the orange zones, the gyms will be opened. What will not be allowed, however, as I was saying, we'll see what it is. But right now, with the intensity of activities in red zones, it's forbidden to do that inside. People can do sports outside. And I get the need, many people's need. Many of us have, in fact, that need. It will be reevaluated, as I said, We're not fixed right now to say that it's going to go on for a long period, but we need that period of stability because that stability over a 2-3 week period is essential for indicators to also allow the healthcare system to start up again. And of course, we wish that we're not going to get surprised with any new strain or strains. And I also wish to be very clear. I wish, as quickly as possible, for gyms to be open so that people can go do that. But we don't have the agreement from public health right now. We don't have the okay.
Oui, bonjour messieurs. D'abord, Monsieur Legault,
Mr. Legault, the Minister for Economy had talked about possible adjustments to the help programs addressed for business owners in red zones if the lockdown were to prolong itself. Now, you're announcing that the lockdown measures are going to keep going. So can it be expected that the measures of help to business owners in red zones that have to remain closed, is it going to stay? Well, I know that the Minister for the Economy is talking about it and speaking about it with the Minister of Finance. I know that they would wish to add measures. So we will be seeing over the next few days.
merci. Et vous avez fait allusion au délestage. J'aimerais savoir
You also alluded to postponement. I'd like to know,
à quel point
Mr. Minister for Health, to what extent
à Montréal, si vous avez
are treatments and surgeries still being postponed in the Greater Montreal area?
dans cette région par rapport au reste du Québec.
How would you qualify the situation compared to the rest of Quebec? Well, the Quebec average right now, as the Premier said so, is at 34%. That is to say that is for Quebec as a whole. So that means that we are delaying about 1 surgery out of 3. So if we usually conduct 2,000 surgeries per day, just to give you an example, that means that right now there are 700 surgeries every day that are postponed if we're at 33%. So it's huge. That is why it's one of our criteria now. Now, in the region, and I was explaining, and right now I'm looking at the documents that are updated on a daily basis for the Montreal region. When we take, rather than being at 34%, we're at about 50% in the Greater Montreal area. The only advantage that we have is that we were able, with agreements in private clinic, to decrease that by about 10%. So in the course of the next few weeks, when we publish these updates, we are going to keep you informed. But we'll also be taking into account the 22 agreements with private clinics that we've signed and who are helping us in decreasing the impact of having had to postpone. So these are documents that will be updated in the chart that we present every day, and you will have that not only for Quebec. We'll see whether we can give you the main regions that are affected. I'll see how I could give you even more detailed information, because we know that it is now a very important criteria. We will now be going to English questions.
Good evening, Premier Legault and Dr. Arruda. I actually wanted to pick up on the question asked by my colleague Patrice, because I actually had the same question. How do you determine that there's an acceptable level of risk when it comes to reopening hair salons across the province, but not gyms? How do you come to that conclusion?
You must understand that gym sports are a higher risk than other kinds of activities, like if you go cut your hair, because there is more inhalation and exploration of resources, and that will be related to the level of transmission in those communities, the impact on the healthcare, the number of cases, the number of outbreaks. And as soon as we have maintained, I would say, a certain stability, we will be able to go to open it. And even, I don't want to talk for the future, but even, I would say, depending on the coverage of the people on vaccination, when we will protect more our elderly people, we can tolerate more cases, because those cases will not go to the hospital or will not be complicated, and even open something. So even the red zones could evaluate related to the context. So it's not because the red is this way now that it will be the same red in 4 weeks from now.
Is there something you'd like to add to that, Premier Legault?
No, I'm listening to public health, but
right.
I like sport.
Okay. So you're easing restrictions in some regions. Spring break is coming up, and you're trying to discourage people from traveling between regions, but it won't be enforced by police officers or roadblocks. So are you asking Quebecers to engage in another moral contract, as you did at one point before the Christmas holidays?
But yes, it's a kind of moral contract. And same thing when we ask people not to visit other people in other houses, it's a moral contract. I think that that's why I insist so much on this situation with our nurses, a situation also with the waiting list, people waiting for a surgery. So I'm asking Quebecers to think about other people. So we cannot watch everything what's happening in different homes. So yes, there's also a question of solidarity.
Philippe Autier, de Gazette.
Good evening. For you, Premier Legault, we still have a fair amount of mystery about what the variants are going to do, what they are about, how bad that will get. And you still have 50% of surgeries being delayed in Montreal, as Mr. Dubé just pointed out. So, and there's some people that would say perhaps this is too risky, even what you're doing, and you're going too fast. I'd like you to respond.
I think it's calculated risk, and it's a balance also taking into consideration mental health and also the situation that we are in since 11 months. And also in discussing with the public health people, we understand that in stores, because that's the main announcement we make today, to open stores, if people wear a mask, keep the 2 meters between each other, the risk is not that high.
And there have not been many cases in stores, if I
Right.
understand right. What can be done to get, because Montreal and Quebec City, the red zones are still a problem. What more can you do to get that under control?
But I think that the most efficient measure we see right now is the curfew. Because, of course, there's a difference between asking people not to visit other homes and implementing a curfew at 8 p.m. Of course, it's easier for us to make sure that people don't visit other homes. So I think it's one of the reasons our success for the last few weeks. So that's why it looks like it's a quite drastic measure to put a curfew, but during the day, people can go to the store, they can go working, go at school, but at night, that's where you have activities in houses. And with the curfew, I think it's a good balance. It's a quite drastic measure, but a very efficient measure.
Okay.
I think if all Quebecers continue to respect the public health recommendations, those lowering is going to be higher. We can be less cases, have less impact on the hospitals. So it's why we are not at the end of the problem, but we approaching with the vaccine and with those rules a better equilibrium and making able to open a little bit, I would say, the robinet, the faucets. In fact, there is always people that says that we are going too fast, others not enough. So it's a balance that we are just trying to find.
Cathy Sonic, CBC.
Good day. When you talked about the reopening of restaurants in orange zone, you say, okay, well, people will call to make a reservation, so we'll know for sure where are they from. Are they from that region? So you take for granted that they're not going to lie. But if you talk about cinemas and theaters, when they will reopen at the end of February, how are you going to monitor people from living in red zone to go to a theater or a cinema in orange zone? How would you do that? How would you monitor, control this?
Okay, first we're asking all people in a cinema to wear a procedure mask, to be at 2 meters. Of course, once you sit, you don't move, you watch the movie. So I don't know.
In fact,
must know,
if we imagine Saguenay-Lac-Saint-Jean is going to be orange. Are you going to go from Quebec to go to the cinema to Saguenay-Lac-Saint-Jean and come back before the curfew? Unless you go there, you sleep there. So I think there's going to be...
There and sleep there?
Okay, but you go there, you sleep there, you go to the cinema in the afternoon, you come back. No, but I know, but we don't think that the probability that people will do a travel so long to see a film is going to be something that is
even though
happen.
they missed it so much.
But look, I'm not telling there's going to be nobody who's going to do it, but most of the people will not do those. Even go, I don't see people from Montreal going to Bas-Saint-Laurent to see a movie and come back. It's going to be expensive. It's going to be a lot of transmission. It's why we are also taking into account the proximity of the red zones and to decide it, because we don't want transfers from red zone to a yellow, or orange, which is very short timing. It's why we are using that approach.
In English, perhaps?
In English, sorry. But just maybe to remind people that when you look at the 6 orange zone, they represent 10% of the population of Quebec. So what it means that 90% of the population of Quebec is still in the red zone. And this has been done by prudence. This has been motivating by, we're not there yet. We had quite a big improvement, but 9 Quebecers out of 10 are still in the red zone.
Okay. And talking about universities and CEGEPs going back for a day in person, some people might have in mind what the University of Sherbrooke has done in the last few months. Are you asking CEGEPs, universities, to have the same inspiration, having classes in churches, having classes outdoor? What are your expectations from CEGEPs and universities?
I know that they were very creative in Sherbrooke, but most of the CEGEPs and universities, they have auditorium, large rooms, where they can put many students at 2 meters from one another. So I think that in most places it will be doable to respect the measures asked by public health.
Raquel Fletcher, Global.
Inside, not...
Good afternoon. It's interesting to see that, okay, so you're opening stores, but also shopping centers because you have to be fair to different people, and then hair salons and museums. These are some of the things that experts that we've spoken with, the scientific articles are saying are at the least risk. But then you also say things like, well, we want to be able to shoot TV series. We want that to be able to continue because we like our TV shows. We opened the libraries because we had a request that was an important service. And then theaters, well, according to you, they're the same risk as restaurants. But there doesn't seem to be the data to put these in an order. Like if the risk is for a gym 60% and a theater is 30%, and is there a way to there has to be data on this to say which is more dangerous than what else, and why can't we have that data?
In fact, there is no numbers exactly. We get some numbers.
Or even if it's low, medium, high. Why can't...
No, but I would say that we know that in gyms, there have been more outbreaks related to gyms than to other things, because people were not respecting the distanciation before and after the gym. That's one of the issues. Some gyms have not respected the 2 meters necessarily, the number actually. So I think it's based on the discussion, because I would say when the Prime Minister talks about public health, I'm not the only one. We talk about all the directors of public health, their experience from what they have seen on outbreaks and everything. Like, for example, when you are in a cinema, it's less risky than in a restaurant. Why? Because you get there, you don't take off your mask, you watch, you are not supposed to talk and everything. In a restaurant, you may do. What we do, we diminish the number of people that can do that. So we know those elements. In a library, if you go to take a book, you get out. That's not really risky. If you have to work, they will make sure that you're going to be at a distance of 2 meters to another one. There is a need for some people to get access to internet to do their work and everything, and even for kids that don't have this capacity at home. So based on, I would say, the risk of transmission, based on the capacity to respect the public health approaches that are going to be put in place, we decide that we can open this in that situation. And I would say, what is going on in your region is going to have an influence on the risk of transmission. So there is no, I would say, perfect number, but it's related to the outbreaks reported here or elsewhere in the world, and the analysis of, I would say, the capacity to respect. Because I would tell you, if we were always 2 meters away with masks, we could even live normally, but we know that we are not that way. As soon as possible, people, even for dinner, will stop their protection, they will eat together, and they get infected at that moment. So it's the way we look at this situation.
But you also said that it's not because it's red now that it's going to be the same red 4 weeks from now. I don't know what you mean by that, and I think a lot of Quebecers don't know what you mean. If there's red, shouldn't there be criteria for?
We have always told this is part of the decision, but we need also to look at the context. Imagine we would have a lot of people vaccinated, okay? The people at risk are going to the hospital. As we know, 80% of the 65 are the ones who get on the hospital. People are vaccinated. Cases that we cannot tolerate right now because they're going to have an impact on elderly people, they're going to get to the hospital. If they are protected, we could have 4, 6 times the number of cases we have now with no impact on the healthcare system. So what I'm telling you that we must take that into context. And what I'm telling you that perhaps in the Montreal region, and I don't want to say that's going to happen, but they will still be on the criteria of red, but we will be able, managing what is going on in the hospitals and outbreaks, to change some of the aspects that of the red, which are still red in the criteria of red that we have right now.
So you're making a judgment call constantly.
Always. I would tell you there is no automatic shift. It's based on those elements, the context, and the I would say the analysis, professional analysis that the Director of Public Health is making with us.
Does that weigh heavy on you, Premier?
Sorry?
Does that weigh heavy on you? That you're the one who has the final say. You're the one who has to make the judgment call.
Yeah, but we had many discussions. We spent most of Sunday afternoon together, and I think that, yes, I'm getting the information from these 2 guys, and yes, at the end of the day, I have to take decision for the best of Quebecers. So what was your question?
If that weighs heavy, est-ce que c'est lourd pour vous?
Yes, sometimes it's low because, like Mr. Arruda said, you will always have people who will say it's too much and other people who say it's not enough. So you cannot satisfy everybody. So one thing is sure, some people will disagree with me.
Alors, la Tribune de la Presse a reçu plusieurs questions. Alors,
So we've received many questions. So I'm going to talk about 2 of them. The first question, François Munger.
on constate encore de nombreux déplacements.
We can see numerous people moving interregionally for non-essential reasons. The citizens from Abitibi-Témiscamingue have strongly showed the presence of numerous snowmobilers in hotels. Why not create new roadblocks between regions? Well, it's a question of cost benefits and choosing the means. I think the police officers are doing extraordinary work, having the curfew respected. There's still going to be a curfew in Abitibi-Témiscamingue. It's just going to be at 9:30 p.m. So I think it's more efficient to ask police officers to make sure that other measures are respected, rather than making sure that there aren't a few people from Montreal or Quebec that are going to go and spend the weekend at Rouyn-Noranda.
Charlevoisien. Alors, la situation épidémiologique.
The epidemiological situation in the Charlevoix region had fewer than 5 active cases. The 2 larger communities in the territories are still red zones, as the metropolitan area. Many people are saying that this is unjust. In this context, can it be explained why the regional division from the national capital region is not being divided? Well, we're not abolishing it. Charlevoix is part of the national capital area, and
Exactly.
Well, why not consider both separately then? For the same reason I was saying before, is that we have to look at all the hospitals. When things are serious, people from Charlevoix go get treated in Quebec City. So it's important to consider the situation of the entire capital region area, but it's true that it can appear to be unjust for the Charlevoix people. Very well, thank you very much. A good evening to everyone. Thank you, and let's enjoy the game.